Now we start with CNS part 3, and in part 3 we are going to complete the general anesthetics, and we are going to complete the antidepressants, anti-anxiety, antipsychotics, and anti-maniac. So these all chapters we'll be completing in the part 3 of CNS. CNS is quite a big topic, and so it has taken 3 parts and a lot of time. So now let's start with general anesthetics. Now general anesthetics may, what are these general anesthetics? Basically these are drugs that actually cause they cause loss of consciousness, right? And along with that they also cause analgesia and muscle relaxation. So the features that we get with general anesthetics is loss of consciousness, analgesia, muscle relaxation, and also abolition of all reflexes, right? Now in general anesthetics there are 2 types of general anesthetics. There are drugs which are inhalational agents, they're called as inhalational agents, and there are drugs which are given by intravenous route, so intravenous agents, right? So we have a separate category of drugs which are inhalational agents, and then we have drugs which are given by the parenteral route, so they are intravenous agents. So let's start with the inhalational agents first. Now there are a lot of drugs in this, so we'll take them one by one. Sabse pehle, let's understand what are inhalational agents. Now these agents, they are basically gases, and they are stored in cylinders, right? Because they have to be given by inhalational route, so they are gases stored in cylinders, and they are delivered to the patient through Boyle's machine. Okay, now this color coding of cylinders is very important, because many questions are asked in which they ask that falana cylinder is this color and dimkana cylinder is this color. So this is very important. So N2O is a gas and it is an inhalational agent. The cylinder is blue in color. Okay, then the next agent is cyclopropane and it is orange in color. Air cylinder is gray body and white shoulders. Okay, gray body with white shoulders is air. Then oxygen is black body and white shoulders. Then carbon dioxide is gray. Then helium is brown. And there is a gas which is Entonox. Entonox is blue body and white shoulders. इसके अलावा भी बहुत सारे cylinders होते हैं, ऐसा नहीं है कि यही cylinders हैं. So if you see any other color cylinder lying around in any place, it can be for an industrial purpose also. So, but these are the medicinal cylinders which are important. What is Entonox? Entonox is a mixture of 50% N2O plus 50% oxygen. Okay, so that is Entonox. Now, apart from the color of the cylinders, another important thing is, so color coding of cylinders के अलावा एक दूसरा index, pin index system. So sometimes they can give you a photograph of a cylinder, or they can give you the photograph of the pin index system, and then they can ask you that which cylinder is this. Pin index system is basically for safety, so that required cylinder fits. Okay, if they try to fit in the machine a wrong cylinder, so fits in the machine at that site, at that particular site. So pin index is basically for the safety. Now what are the various pin index numbers? So air का pin index number है 1.5, oxygen का pin index number है 2.5, N2O का pin index number है 3.5, carbon dioxide more than 7.5%, hyperbaric carbon dioxide is 1.6, then a normal CO2 less than 7.5% is 2.6, cyclopropane is 3.6, and Entonox is 7. तो ये इनके pin index system है, pin index numbers हैं. So to remember the color coding, and you also have to remember the pin index. Now there are 2 important things which are usually studied when we study the inhalational agent. 2 concepts are there. One is the minimum alveolar concentration, that is also called as MAC, short form. Now what is minimum alveolar concentration? This is the minimum concentration of the drug, of the inhalational agent, which is required in alveoli to produce unresponsiveness to skin incision in 50% patients. So in 50% patients, unresponsiveness to skin incision मतलब पेशेंट को एनेस्थेटाइज हो गया है 50%. 50% पेशेंट में एनेस्थीसिया इतना हो गया है कि उसे स्किन इंसिजन फील नहीं हो रहा है. सो इन दैट कंडीशन द मिनिमम कॉन्सेंट्रेशन विच इज रिक्वायर्ड टू प्रोड्यूस दैट रिस्पॉन्स इज द MAC. Now a very important fundamental is that it is the measure of potency. Okay, so more is the MAC, less is the potency. Please remember this. Agar the concentration required to produce 50% response is more, then that means the potency is less. So it is seen that N2O has maximum MAC, so it is least potent, right? So N2O is not a good complete anesthetic. Then the drug methoxyflurane has least MAC, and so it is most potent. Okay, then the second fundamental is blood gas partition coefficient, right? Now what is blood gas partition coefficient? Now this basically, it is determined by the solubility of the drug in the blood, right? So when a drug is inhaled from the as a gas in the alveoli, it has to go as a gas in the blood. Now that depends upon the solubility. More is the solubility, the drug will spend less time in the lungs and it will immediately get transferred to the blood, right? And a drug which has got a low blood gas solubility will not go into the blood so fast. It will try to remain in the lungs for longer time. So this blood gas partition coefficient, it basically determines the onset and recovery. By onset or recovery, दो ही time पर only at 2 times this blood gas partition coefficient is required. So it is seen that more or greater is the blood gas partition coefficient, less is the speed of onset and recovery. So more partition is there between blood and gas for a drug, then that means it will take it will take more time to solubilize in the blood, and so the speed of onset and recovery will be the lowest. Now in this, xenon is the drug, is the gas, it is the fastest acting as it has minimum blood gas partition coefficient, right? Then we also have desflurane, which is also fast acting, and the drug which is slowest acting is methoxyflurane. It is slowest acting. Now earlier I've written methoxyflurane is the most potent because it has got least minimum alveolar concentration but it has got the highest or the maximum blood gas partition coefficient. It has got a maximum blood gas partition coefficient, so it is slowly acting, slow onset and slow recovery, right? Then there is another drug which is almost obsolete now, but we just studied for the historic purpose, that ether. This also has got a very high blood gas partition coefficient, and so it is also one of the slowest acting agent. And earlier classification was based on ether anesthesia, right? The जो classification की various stages, 4 stages of classification हम पढ़ते हैं, so that is based on ether anesthesia. Now let's see the systemic effects. What are the effects of these inhalational agents? So because they are anesthetics, they are definitely going to reduce or sedate. So the first action, if we see on CNS, is sedation, like unconsciousness. Then on respiratory system, they cause respiratory depression, which is maximum with enflurane. Okay. Then they also blunt the response to hypoxia and hypercapnia. This is seen maximum with halothane. Okay, then another thing is they also cause bronchodilation. So they are beneficial in asthmatics, and this is again maximum with halothane in asthmatics, right? And sevoflurane also has this effect. Then they reduce the ciliary activity also, except ether. Ether increases the ciliary activity in respiratory system. Then next we have their action on the CVS. So CVS may they cause hypertension. All of them, they reduce the blood pressure. Now maximum response is seen with the isoflurane, and so isoflurane is used in anesthesia for producing controlled hypertension. Okay. Then except one drug, which is cyclopropane. Now cyclopropane increases blood pressure, so it is preferred in patients with shock condition. जहाँ पे BP कम हो गया तो वहाँ पे फिर cyclopropane is preferred. Then they reduce the cardiac output, and this reduction in cardiac output is seen maximum with enflurane, right? Except isoflurane and desflurane. Okay. So in reduced cardiac output करते हैं, maximum seen with enflurane. Then they also reduce the cardiac contractility, right? So basically in general, what they do is they reduce the CVS responses. They also reduce the baroreceptor reflexes. Their reflexes are blunted, right? And this is maximum seen with halothane. Isoflurane doesn't do this, so it is used in cardiac patients. It is the drug of choice in cardiac patients. Then talking about liver में basically these drugs, which one? Halothane, chloroform and methoxyflurane. they are hepatotoxic. So these drugs can result in liver toxicity, and क्योंकि ये metabolize होते हैं वहाँ से, तो इसलिए hepatotoxicity करते हैं. Then what is their effect on renal system? So it is seen that methoxyflurane can result in vasopressin resistant polyuric renal failure due to high fluoride content. Okay, so fluoride, presence of high content of fluoride in it, because methoxyflurane has the highest fluoride content. So fluoride basically is added to reduce the inflammability of these agents. Then next action that they do is on blood. Blood में nitrous oxide can result in megaloblastic anemia by causing vitamin B12 deficiency, right? What is their effect in skeletal muscles? Skeletal muscles में all these drugs all are good muscle relaxants, except which is the drug which does not cause muscle relaxation except nitrous oxide, and maximum muscle relaxation is caused by ether, but we don't use it now. Then next effect, analgesia. Now maximum analgesia is obtained from N2O. Sorry, maximum analgesia is obtained by a gas called trilene, which is actually trichloroethylene, right? Otherwise these drugs are not very good analgesics. Next we have their action on metabolism, though metabolic effect. What is their action on various metabolic parameters? Now it is seen that these drugs, they cause hyperglycemia. They can disturb the diabetic balance. Then inflammability. So it is seen that ether and cyclopropane are highly inflammable, right? That means they can cause fire. So it is very important cautery not to be used in these agents. In ether and cyclopropane, cautery should not be used if you are using them, because it will cause fire. Second is reaction with soda lime. Soda lime होता है, उसके through ये pass होती हैं. So there are reactions. Now in closed circuit where soda lime is being used, sevoflurane, trilene and methoxyflurane not used, should not be used. Okay, sevoflurane क्या करता है? It reacts and produces compound A, which is nephrotoxic, right? This trilene, it produces a compound which is called as dichloroacetylene and phosgene, and this causes neurotoxicity, and this causes ARDS, right? And what does methoxyflurane do? Methoxyflurane reacts with the rubber tubing of the system. So in closed circuit, sevoflurane, trilene, methoxyflurane not to be used, because they can produce these toxic compounds. So these are important points. Now let us see them one by one. सबसे पहले हम लेते हैं N2O, which is nitrous oxide. Now see, anesthetics में point होते हैं, छोटे points बहुत सारे हैं. Nitrous oxide is called as laughing gas. So you have to remember all of them. It is a colorless, non-irritating, non-inflammable gas. Cylinder color क्या है इसका? Cylinder color है blue. Then it is a good analgesic, but weak anesthetic, right? It has got a highest MAC and very poor muscle relaxant, right? It does not cause a good muscle relaxation. It shows faster induction and recovery because it has got a low blood gas partition coefficient. Then it is used in concentration of 50 to 65% with 33% oxygen. And I had told you earlier also, Entonox is a mixture of 50% N2O plus 50% O2. Okay? Now there are two more phenomena. That is called as three more, I'll say, concentration effect, which is seen with gases. So concentration effect, especially with nitrous oxide. Now this is concentration effect is seen with N2O. One second. So this phenomenon, concentration effect, which is seen with N2O, इसी के साथ दो और effect देखने को मिलते हैं. That is diffusion hypoxia and second gas effect. तो इसको समझते हैं. Let's understand what is this. Now N2O has got a very low blood gas partition coefficient. That means it is very highly soluble in blood, right? And so it is very fast. It has got a faster induction and faster recovery also. Now what happens is when N2O is given. Now when it is given in very high concentrations, then since it is very fast diffusion occurs from alveoli to blood, right? Now so there is, this generates negative pressure in alveoli, which causes more removal of N2O from cylinder. So this is concentration effect. Then because N2O is highly soluble in blood, so when it is given in high concentration, then very fast diffusion occurs from the alveoli to the blood, which causes negative pressure in the alveoli, and because there's a negative pressure in the alveoli, more of the gas comes from the cylinder, more gas is removed. इसी में second gas effect आता है. Second gas effect क्या होता है? That when suppose another agent is given with N2O, then when this N2O is due to negative pressure, more N2O is removed from the cylinder, then here also due to negative pressure, this gas also gets removed. This gas is also taken up from the cylinder, right? So suppose halothane is given with N2O, so more halothane will be taken from the cylinder. Now इसमें अब diffusion hypoxia. What is diffusion hypoxia? Diffusion hypoxia is that now when N2O is stopped, right? When N2O is stopped, then now because it has got a good solubility in blood, but again the partition coefficient is there, so immediately now when the N2O is stopped, because of the diffusion gradient, more drug will come into the lung. So when N2O is stopped, then N2O enters alveoli from blood, right? So fast diffusion occurs from the blood to the alveoli now, and that will result in what? Less absorption of oxygen, which will result in hypoxia. So if you stop N2O, then the N2O that is there in the blood will now enter alveoli because it has got a low partition coefficient. So recovery fast होती है. तो जैसे ही आप N2O बंद करोगे, all of N2O which is there in the blood will start coming into the alveoli. Now it comes into the alveoli, and thus then less absorption of oxygen occurs, and that causes hypoxia. So how can you prevent it? This hypoxia is prevented by giving supplemental oxygen. Give supplemental 100% oxygen before stopping N2O. So that means we'll try to reduce the hypoxia by giving supplemental oxygen before you stop N2O. So these are the three important phenomena seen with N2O. I have explained to you in detail because concept clear होना जरूरी है, ठीक है? So this is about N2O. N2O के 2-3 points और हैं. N2O is a very important drug that way अगर हम देखें इसको question wise. So N2O क्या करता है? It can cause methemoglobinemia and laryngospasm. These things are seen with N2O due to impurities, right? What are the impurities? Nitric oxide and nitrogen dioxide. Due to impurities in N2O of nitric oxide and nitrogen dioxide, it can result in methemoglobinemia and laryngospasm. Then it causes bone marrow suppression and megaloblastic anemia due to vitamin B12 deficiency. This can also result in subacute combined degeneration of the spinal cord, right? Then N2O is contraindicated. Now it is very important, contraindicated in pneumothorax and volvulus of the gut, okay, because it can result in increased pressure in closed cavities and can result in pneumothorax, pneumoperitoneum, and those things can happen. It can increase the problem. So it is contraindicated in pneumothorax and volvulus of the gut. This is very important. It is used as a supplement to other anesthetic drugs, but not as a anesthesia as a whole, and it can also be used as a carrier gas for halothane. Halothane is the main inhalational agent which is used, so this can be used as a carrier for halothane, right? Now next drug that we have to see, second drug that we see is halothane. जो important drugs, and we are discussing more points about them. The later drugs are not so important, so they don't have so many points. Now halothane is a colorless, volatile liquid, right? It is non-irritant, non-explosive, and pleasant smelling agent होता है. It is stored in amber colored bottles because exposure of sunlight can oxidize this, right? And it contains thyroid 0.01% as preservative. Then it is a good anesthetic drug but poor analgesic. Analgesic action is not there, so you have to use. Then it can result in hepatitis on repeated use. अब repeated तो कौन use करेगा ना halothane? Anyway, so it causes hepatitis. Then it important चीजें क्या है? It causes malignant hyperthermia, and this is treated with dantrolene. Dantrolene is a calcium channel blocker, ryanodine receptor blocker, and so reduces the features of malignant hyperthermia. Then this is the drug which is responsible for post anesthetic chills. Patient को shivering होती है ना after the anesthesia. So this is the reason post anesthetic chills happen, and treatment के लिए you use pethidine, which is a morphine congener for the pre anesthetic chills. Then halothane relaxes the uterus, so it is used agent of choice in internal version and manual removal of placenta, right? But because of this, it is contraindicated in labor because it can result in the relaxation of uterus and cause postpartum hemorrhage, which will be difficult to control. Then very important thing, it sensitizes the heart to adrenaline arrhythmogenic actions. So it is contraindicated in pheochromocytoma. It can result in arrhythmia, can precipitate arrhythmia. Okay. Then it is a cardiodepressant drug. It causes hypotension and bradycardia by itself, right? Then it is the drug of choice in bronchial asthma because it causes bronchodilation. Then it is also used drug of choice in induction in children, right? So these are the important things related to halothane. Next we take the agent which is ether. So ether is the third agent that let's discuss. Now ether, basically it is not very popular now because of its certain properties. It is pungent smelling, it is irritant. So when it was given to the patient, there was a lot of struggle, excessive secretion was there. Then it is highly inflammable. So if you use ether, then you cannot use cautery. It can produce explosion. So it is an explosive agent also, right? So cautery cannot be used. Then it is a very good analgesic, but it is a good analgesic and muscle relaxant, but it is slow in induction of anesthesia, right? Then it causes bronchodilation, so it can be safe in asthmatics. It is the safest agent in unskilled hands. Then it can result in hyperglycemia. So these were some properties of ether. Okay. The fourth agent that we discuss is enflurane. Now enflurane is basically halogenated ether. So halogenation reduces the inflammation, and halogenation decreases the inflammability. Not the inflammation, sorry, inflammability. Right? Enflurane is contraindicated in epilepsy as it raises the intracranial pressure. Then it is also not a good analgesic. Okay. Next drug that we take is isoflurane. Now isoflurane, it is basically an isomer of enflurane. Not a good analgesic. Then cardiac output is maintained. So it is used in cardiac surgery, right? Also used in neurosurgery. So this is important. See, it is the drug of choice in cardiac surgery. It is the drug of choice in neurosurgery, right? Then it can be used to produce controlled hypotension because it causes maximum decrease in the blood pressure. Then can be used in daycare surgery, right? It is safe in pheochromocytoma as it does not sensitize the heart to the action of adrenaline, and it can cause coronary steal phenomena. So it is not a good choice in myocardial infarction, right? So this is something about enflurane. The next drug that we discuss is, what is that? Desflurane. Now as the name itself suggests, it is again an isomer. Now this drug has the minimum blood gas partition coefficient. So it has got the fastest induction, right? Fastest inducing agent. It has got very high vapor pressure, so boils even at room temperature. So special vaporizers are used. So vaporizers required or needed. Then it produces cardiovascular effects similar to isoflurane, so causes coronary steal phenomena. Then induction is unpleasant. It is not a pleasant induction. It is an irritant to the airways, so can result in laryngospasm. Then can be used in daycare surgery, right? It can be used in daycare surgery. Now this is about desflurane. Next we have sevoflurane. This is the drug of choice for induction in children. Then sevoflurane not used with soda lime in closed circuit because it produces compound A, which is nephrotoxic, right? Next drug we have is methoxyflurane. What is the number there? 7. So the drug that we discuss next is methoxyflurane. Methoxyflurane has got least MAC, so it is most potent inhalational agent, but it has got the highest blood gas partition coefficient, so it is slowest induction and slowest recovery, right? Then it can lead to high output renal failure because of the highest fluoride content, and again not used in closed circuit because it reacts with the tubing of the circuit. Then the ninth drug that we take is trilene, which is also called as trichloroethylene. It is one of the most potent analgesic. Analgesia अच्छा करती है. Trilene not used in closed circuit because it produces phosgene gas, which can cause ARDS, and causes dichloroacetylene, which is neurotoxic, right? Can be used because it is a good analgesic, can be used in labor as analgesic. Then next drug we have is cyclopropane. Now cyclopropane is highly inflammable and explosive like ether. So cyclopropane का ये problem है. Cylinder का color इसका क्या होता है? Cylinder is orange in color. Then it is the drug of choice in hemorrhagic shock because it increases the blood pressure, right? So it increases the sympathetic tone, so can be used in shock condition. Then stop slowly, as sudden stoppage can result in hypotension, which is called as cyclopropane shock. Okay, so this is about cyclopropane. Next we have chloroform. You all must have heard about chloroform and seen in the movies also how it was used for anesthesia, kidnapping and all. Now this is a cardiotoxic agent, so it results in ventricular fibrillation. It is also a hepatotoxic drug and it also causes hyperglycemia. तो अभी आजकल chloroform तो कहीं पे भी use नहीं होता है. Okay. Then some other agents are there. One of them is carbon dioxide. Carbon dioxide का cylinder होता है grey color का, and it is used in creating pneumoperitoneum in abdominal laparoscopies. उससे क्या होता है, पेट में हवा बन जाती है, गैस बन जाती है, and it gives a clear view to the surgeon. So it is used to create pneumoperitoneum in laparoscopy. Then next drug we have is helium. Helium is lighter than air, so you'll see that the balloons filled with helium, they rise in the air. Then a mixture of 80% helium and 20% oxygen is used in tracheal obstruction. Okay. Next we have a drug which is called as xenon. Now xenon is Greek word, it means stranger. This is a gas which is anesthetic under normobaric conditions. So this is an extremely rare gas and very close to an ideal agent. So xenon जो है gas, वैसे it is not used for as a anesthetic agent. It is basically colorless and odorless. Then it has the lowest blood gas partition coefficient, so it has got a rapid induction and recovery. It is a good analgesic, anesthetic and muscle relaxant. MSE is 60%, so reasonable inspired oxygen concentration is there, moderate is there. Then it does not cause respiratory depression, no effect on CVS, not metabolized in body, excreted via lungs. It is non-toxic, no interaction with soda lime. Then it is stable on storage, non-inflammable. The only problem is it is highly expensive, so routine use is not possible. So these are the inhalational agents that we have completed till now, right? The next drugs that we have now or we discuss are the intravenous agents. So these are the drugs, intravenous agents. They are fast acting and slow acting. So fast acting are used in induction and the slow acting are used for maintenance. So in this, the drugs that we have is thiopentone, methohexitone, ketamine, propofol, etomidate. These are the fast वाले, and slow में आते हैं हमारे पास. We have BZTs, benzodiazepines, then opioids, then some neuroleptic agents, okay, like droperidol. So these are the slow acting agents. Okay, so let's complete one by one. Let's take thiopentone first. So thiopentone is a short acting barbiturate. There are only two barbiturates which are used. One is thiopental as an anesthetic and one is phenobarbital as an antiepileptic. It is the most commonly used inducing agent, right? Now it is used as a 2.5% solution. Now a very interesting fact about thiopental, you all know that it is very highly lipid soluble, right? So due to high lipid solubility, it has a phenomenon which is called as redistribution, in which from the brain say it goes to fat, right? And so continuous IV infusion is required to be given. Then now next thing, it has got anticonvulsant action. So this can be used for ECT, that is electroconvulsive therapy. Then it is the agent of choice in cerebral protection because it decreases the oxygen consumption, it decreases the intracranial tension, it decreases the metabolic rate. So it is said to be cerebroprotective. Then it causes peripheral vasodilatation, so it can result in hypotension. Okay. Then it produces hyperalgesia. It, instead of producing analgesia, it produces hyperalgesia. Then respiratory depression and apnea can be seen with this. Another very important thing that with thiopental you have to remember, on accidental injection in artery, it can result in thrombosis, vasoconstriction करेगा, and it results in necrosis and gangrene, ischemia. Necrosis is too big a word, it causes ischemia. So what you do now, the first step is to leave needle in situ. Don't take it out, don't withdraw the needle, just leave it there in situ, right? Then second, dilution with saline to be injected so that it gets diluted. Third, immediate heparinization, immediate heparin has to be given, right? And papaverine. So heparin will prevent coagulation, thrombosis, papaverine will relieve the spasm. Then fourth, you can give vasodilator. One second, right? Vasodilator दे सकते हो आप, इसमें lignocaine दे सकते हो, urokinase which is a fibrinolytic can also be given, right? Then brachial plexus block and stellate ganglion block, they both can be given. Sixth, absolute contraindication in it is not this point, it's a new point, absolute contraindicated in acute intermittent porphyria. So just because barbiturates are contraindicated in acute intermittent porphyria, so we cannot give thiopental in this patient, right? So this is about thiopental. Some very important points are there. Second drug that we see is methotrexate. Now this methotrexate is a very ultra short acting barbiturate, right? It is 3 times more potent than thiopental. It induces seizures, so it is used in ECT, electroconvulsive therapy. I am wrong, in the earlier part thiopental I have written thiopental मैंने लिखा है. It is an anticonvulsant. It is not used for ECT because of its property of reducing the convulsions. It cannot be used in ECT. Methotrexate induces seizures, and that is why it is used in ECT. Okay. Then next drug that we have, the third drug that we discuss is ketamine. Now ketamine is basically a hallucinogenic. Okay. So it is hallucinogenic, and this is delivered in the dose of 2 mg per kg. Onset of action is within 30 to 60 seconds and 15 to 20 minutes में होता है, and there is redistribution. This drug blocks the NMDA glutamate receptors, and so it reduces the cerebral activity. Then ketamine is a very good, very strong analgesic but poor muscle relaxant. Now the type of anesthesia that it produces, that is very special. It produces dissociative anesthesia. Okay, this is the anesthesia that it produces, dissociative anesthesia. That is that means it's a state of analgesia, amnesia with light sleep, immobility, and there's a feeling of dissociation from the own body. Okay, it does not depress the pharyngeal and laryngeal reflexes, so it is the agent of choice in emergency anesthesia with full stomach, right? So because it does not depress the reflexes, so it is agent of choice in anesthesia with full stomach, because vomiting will happen and vomiting will prevent the aspiration. Okay, then this drug increases all pressures, so it is the IV agent of choice in shock because it increases the blood pressure. Then it is contraindicated in glaucoma, and it is contraindicated in head injury, right, because it increases all the pressures. Then it is a powerful bronchodilator, So it is used in IV agent of choice in bronchial asthma, right? Inhalational में कौन सा था? Halothane. Then it is the IV anesthesia of choice in induction in children. Inhalational में कौन सा था? It was Isoflurane. ठीक है? Now on stoppage, several adverse effects can be seen which are called as emergence reaction. जिसमें सबसे पहला इफेक्ट जो होता है वो होता है hallucination, in which patient sees vivid dreams and illusions and excitement. So this is something very important about ketamine. The next agent that we discuss is propofol. Now propofol is basically a milky white powder, and it is preservative free. So has to be used within 6 hours. Then this is an oil based preparation, and so the injection is painful, right? Then onset of action is within 15 seconds, and it lasts for 5 to 10 minutes due to redistribution. Then it has got very strong antiemetic and antipruritic action. It decreases the blood pressure, right? Decreases the respiration, so causes respiratory depression. Then it has no muscle relaxant activity, and it is cerebroprotective. But it does not have any anticonvulsant action. It can precipitate myoclonic jerks and muscle twitchings. Now these are seen with propofol. Okay, it is the IV agent of choice in daycare surgery, right? And what was the inhalational agent of choice in daycare surgery? Inhalational agent of choice was desflurane. Okay, so this is about propofol. Another important thing, propofol is also the IV agent of choice for sedation in ICU. Then it is also the IV agent of choice in malignant hyperthermia patients. So where now you cannot give halothane, so you can give propofol. Then this is also the drug used with alfentanil for total intravenous anesthesia. Okay, propofol is the drug of choice in so many cases: daycare surgery, sedation in ICU, malignant hyperthermia, and total intravenous anesthesia. Then the next drug that we have is etomidate. Etomidate is basically does not interfere with the cardiac, so agent of choice in aneurysms, surgeries, in cardiac diseases. There inhalational agent में कौन सा drug use करते थे हम? Isoflurane. Isoflurane is used in cardiac and neurosurgeries. Here inhalational agent में etomidate is the drug of choice. Then it causes minimum respiratory depression. It causes maximum nausea and vomiting. Then it produces myoclonus. Injection is painful and results in thrombophlebitis. It can lead to adrenocortical suppression and can also lead to vitamin C deficiency. So these are the important points related to etomidate. Okay, now let's see the slow acting agents. Slow acting agents में हमारे पास क्या-क्या हैं? What are the drugs that we have to discuss? Benzodiazepines are there, then opioids and neuroleptic agents, right? So benzodiazepines पहले देखते हैं. Now benzodiazepines में we know the drugs which are used are diazepam, lorazepam, midazolam and remimazolam. This is a new drug, remimazolam, right? Now these drugs, they are not analgesics, right? These drugs do not cause analgesia, but they cause muscle relaxant and anti-convulsant action. Then lorazepam is the drug of choice in pre-anesthetic medications, right? Then midazolam is used in daycare surgery, right? These drugs, इसके अंदर एक होती है, they cause anterograde amnesia. BZDs can cause that. So anterograde amnesia usually is there. Now the new drug that I was telling, remimazolam. This is rapid and short acting than midazolam. So this is the drug of choice for sedation in short procedures. Okay. right? Then the second drug that we have is opioids. Now opioids, what are the drugs which are used? We have fentanyl, sufentanil, alfentanil, and remifentanil, right? These are the drugs which are used. Now they are 100 times more potent than morphine, right? We know that sufentanil is the most potent. They are very strong analgesics. Then fentanyl is used with droperidol to cause, what does it cause? Neuroleptic analgesia. If you add N2O, then it becomes neuroleptic anesthesia. That is N2O plus fentanyl plus droperidol. Okay, they can cause post-operative muscle rigidity. You should remember here that succinil causes post-operative muscle pain and fasciculations because it initially causes contractions, right? Then alfentanil is used in daycare, surgery, and total intravenous anesthesia. It can be used with propofol for that also. Remifentanil is the shortest acting opioid. Why? Because it is metabolized by esterases. Okay, then next we have the third category is neuroleptic drugs. Now what are the neuroleptic drugs that we use? In this, the drug that we have is droperidol. It is a D2 receptor blocker. Now this droperidol is used with fentanyl to produce neuroleptic analgesia that we have seen earlier. It can produce extrapyramidal symptoms because it is a D2 receptor blocker. So let us summarize the anesthetics now, and then we finish this general anesthesia. For daycare surgeries, we use propofol as IV agent, and we can use desflurane as the inhalational agent. Ischemic heart disease, a patient cardiac myocardial infarction, the drug of choice is etomidate. It is best in cardiac surgeries. Here we have isoflurane, right? Congestive heart failure hagar, then left to right shunt, you use isoflurane. Right to left shunt, use ketamine, right? Shock condition, use ketamine. Then to produce controlled hypotension, we use isoflurane because it produces hypotension to the maximum extent. Then in asthma and COPD, we use ketamine. Halothane can also be used because it is also causing bronchodilation. Epilepsy patient, because of its anticonvulsant property, we use thiopental. And for ECT, we use methotrexate because it produces convulsions. Then thyrotoxicosis, thyroid patient. So thyrotoxicosis may we use thiopental, right? Cardiac surgeries are told we use isoflurane. Neurosurgery also we use isoflurane. So these are some summaries of the anesthetic drugs that are to be used in particular conditions. So now with this we finish the anesthetics, and the next chapter that we take up is the psychiatric disorders, mood disorders.